do that. We will. Thank you. Appreciate it very much. We've got two more. We have Jane Kinsey. Jane's our Director of Social Services. Jane, welcome.
Yes, thank you. Passing around a briefing paper, I thought that might be the best thing. I know we're here to speak about next fiscal year's budget impact. And I just have to say that we're well enough at this point. We've had County Commissioner Association conference calls. We've had letters to county managers trying to keep all the players in the county informed too that there's just a lot unknown about NCFAST. And so this paper was developed the second week of January, so it's fairly current. But I want just to give you a little bit of the background so that you have a basis of what we're talking about too. NCFAST is North Carolina Families Accessing Services through Technology. And it is the first integrated software program that would combine all of our economic services programs into one application. And I have to say, I've been DSS director 25 years. We've been working on it 24 of those 25 years. So, and we got close. We really did. We think we got close. But as you know, any technology overhaul, you're going to have lots of challenges. So we know that the best benefit for our consumers is to tell their story one time and get the services they need. That's what we're after. In November of 2012, food and nutrition was the first phase of implementation. We were able to start taking applications for the food stamp program. Then in the spring, we converted 6,000 individuals into our NCFAST system. We thought that was the foundation for the full implementation, but then we had Affordable Care Act that was implemented. So they had to weave that into the NCFAST program. What was going to be an integrated system became two systems, basically. Kevin can identify with some of the challenges that we've all had. Even though North Carolina didn't expand Medicaid, we didn't expand the rules, we still had to participate in a federally facilitated marketplace so that people that were being screened for Medicaid, potentially eligible, would be also screened and sent up, so to speak, into the cloud. I'm not sure what they call it really, but it would be trying to get them enrolled if they're eligible for Medicaid. As of last week, and Derek sat in on a conference call, and Mike also, at that first conference call, we had 10,000 apps pending. We've got 60,000 apps statewide pending. So they call it the dump. We keep waiting to have those applications sent down to the local counties to be processed. So at this point, we don't know exactly how many are going to be making counties. Originally, they were giving us reports. We were at about 100. Now, that was when we had the 10,000 apps. Now we're at the 60,000 apps, so we just don't have any idea. So our system, our county was in good shape. In July of last year, we were in good shape. And we thought we saw that it was all going to work perfectly. Then when they started the Affordable Care Act and loading the rules in July of last year, that's when we started having the issues with food and nutrition services again. And I'm sure you've seen the media attention that we're in trouble in meeting the USDA guidelines of processing the applications and recertifications. So currently, there's the greatest concern of meeting those rules, or we're going to lose administrative funding. I can tell you locally, we don't have the problem, but we're one of 100 counties. So if we all don't meet it, there's the potential we're going to lose some administrative funds.
It got so bad that, of course, Jane knows 161 people were authorized to go into the county to train for NCFAST. After 4 days, they were all told to come back home. They weren't ready for the training because nobody knows what they were training. So that happened. Numerous other problems. In turn, several counties have entered into a class action lawsuit against the North Carolina Health and Human Services because there's such a backlog in these larger counties especially that hits, they've had to double staffs in a lot of counties. And had not been for Jane Kinsey and her knowledge of everything, we'd be in the same boat. So
Well,
it's a real
we've got a
problem.
great team. We have got an awesome team, and I think we're very, very thankful, probably the best team ever, to try and work through this process. But just, I want to show you real quick, what was an integrated system, this is the first step now, and there's your decision-making tree, just to enter it into the system. Originally, before we had to load the Affordable Care Act, you just put the information in, you didn't even have to worry about, did you need this application or that? There are two dashboards. You have to determine if it's a traditional application or a streamlined application, what they're calling it. So it's created lots of challenges. I want to assure you, though, that on benefits locally, again, we have not had the issues. If anybody runs over the 30 days, we are able to send it up to the state. We had a few, we had to give food cards, and then they've expedited trying to track it, but it's in the system problem. So we have help desk, we have tiers, trying to get them escalated to make sure that nobody goes without benefits. That's our goal. And that's the food and nutrition. That again, we were doing fine, Affordable Care Act came in, and now we're not doing fine statewide. But now, we were supposed to hard launch, and I know this is about next year, but the immediate need, if we don't get, our requests are on the back of this, our Directors Association has asked there be a delay. We cannot move forward, we're not ready for the class action suit because counties recognize we're not ready. You can get food cards, you can't very easily get hospital bills, doctors, prescription meds. Those are the things that are going to be more difficult to provide if we can't get the benefits through the system. So, to that end, if we're not able to delay this implementation, which again would be coming February, mid-February, and honestly, 2 weeks ago I had a lot of hope that it would happen, but now I'm hearing there's a price tag to that because of some of the rules that change. Even though we didn't expand Medicaid, some of the rules do change on what is countable and non-countable due to the Affordable Care Act. So because of that, I'm not sure the state will approve us to be delayed. Of course, things change daily, as we know how that goes. So what I'm asking to do is we'll evaluate it closely, make sure that we understand the impact. But I have good news, I really do. There's a positive here. Because of the Affordable Care Act, they are going to give us additional administrative funding. So what has been costing all of our economic services is a 50% county. And the county manager conference call was to try and educate. These are additional dollars that you're going to be receiving when they work through this system. But we need those resources directed to making this system successful. In other words, if we have to hard launch, we're going to have additional temporary emergency staff to help with that process. And it would be, we would use our experts to really do the processing, but it would be to help with the intake. We're going to have to close all of those applications and reopen. All the current recipients, have to be closed and re-entered into the system. So we can have people close them, we can have them re-enter, but we got to have somebody else process them under the new rules. Much as I like to say the system is totally integrated, rules-driven, smart system, it isn't. It's really a struggle to figure out how to navigate. So what I'd like to do, we've identified that we'll get about $40,000 additional federal money in this budget year, utilizing the NC FAST system if we hard launch again. So we need to get 3 emergency temporary appointments. I'd like to start advertising Monday because, again, I don't know if they're going to delay. Second week of February is not far away. And to get them on staff, get them trained as much as possible. Then also, in all of this, we open up the heating assistance program to all households February 1. This division is the one that actually helped with administering the program. There's no way they can do that. They've got to get caught up with all the rule changes, trained and understanding it again for hard launch. And so we need to get one person, which we'd like to contract with a recent retiree, Beth Nicholson, to come back in and help us with that program. So we would have 3 people. We already have 1 contract position. And then have one person that we've identified within the agency to reassign. And then have this 3rd person coming up there.
What Jane ain't not telling you that it's expected this will be an all-time record number of people applying for assistance.
Yes, it will.
Simply because, you know, we've not had temperatures like this in many, many years. And the TANF, we saw that when the TANF dollars were available and the demand and how long it lasted. So you don't have no choice.
Right. February 3rd, you don't want to come over to Health and Human Services because you won't find parking, you won't have people coming out the doors, and that's good. That's what we're here to do, is to help people help themselves. That is what we want to do. But we're going to have some resources. I really hoped I could come today and say, we got the extension. But Ronnie was in Raleigh yesterday, we don't think we're going to get it.
They don't know, well, I mean, what they did, the state was looking at a whole Medicaid revamp. But during that revamp, these rules come into play, whether we're ready or not, and it's not ready. But the extension part, there's nobody there that can answer the question, but as of now, it stands, so.
We have to move forward as it stands. The other request we would have is we've never paid overtime. We've always done flex time, that's time and a half. I can't do the whole here, so for this opportunity, since we do have additional funds, we would want to pay any overtime to the staff, because they really understand and know the system and will be there to work it, doing some flex hours early in the morning, later afternoon, and on Saturdays.
Do you have those funds?
Yes, we have. We'll have them with the additional federal dollars, and they're coming.
What's the timeline? They talked about that too. Do you have a timeline? Or they give you
When the dollars start, the codes start, letters being developed.
Okay.
Yeah. Well, and we're running below on our salary line item budget, so I think most everybody knows that we won't overspend our budget. There's just not any way we can do that. So.
It's temporary periods for how long?
The temporary would be dependent on how long if we get any extension, of course. But I would come back with next year's budget if it does need to be extended longer.
And you don't even know the load yet, do you? The number of cases.
Well, the 6,000 would have been 60% of our Medicaid caseload. The 6,000 individuals in food and nutrition also got Medicaid. So we have to redo all those. So there's those 6,000 individuals. We're estimating probably another 4,000 that have to be put into the system. That's before the dump. We call it the dump because it's coming from the feds down to us. So we really don't know what to expect numbers-wise. I can tell you, it's really sad when you have to hand count, and we figured out this is our caseload, because used to we had a really great chart that can pull it all out, called data warehouse. Because now we have 2 systems, we're having to go in and try and figure it out. And I said, guys, just quit trying to figure all the details. We will be successful. I just want you to be assured of that. But I do have to have the resources to be successful. And we've got federal dollars that we can meet the demands of the current budget. And then we will get those dollars ongoing. Those dollars will be available in next budget year too. So we would factor as much of that in too as we can. So I'm hoping I can tell you on NC Fast, there will not be an increase in county budget to implement this program.
So we don't need to take action.
No, it's.
Because you're operating within your budget.
Yeah, we're operating, we're not asking for any money.
Right.
I just wanted.
You're just giving money.
Yeah. Right. So I talked to Mike a little bit. I said, I'm not going to blindside you here, but we're going to be asking to go in and start advertising. Yeah, for the emergency, temporary emergency.
But that, you can do that at the department, you don't need our.
Right. But y'all are aware of what's happening. As we know what the decisions are for next fiscal year's budget, we will, of course, keep everyone advised as much as possible. I will tell you on next year's budget, I tried to get the details, even though NC Fast is on the agenda. If the assisted living facility that's been built over at Macon Bank is open, it will have an impact on our budget with the special assistance payment rates. But I'm not been able to find out exactly when they project that facility will be open, so that will be an impact. Any questions?
Thank you, Jane.
Thank you, Jane. Don't go before good.
You got the right people in there, Hill.
Okay, thank you very much. Everybody be patient. We're at Old Farmer City. We're in a short road. Andy's, we have 15 minutes each.